Hello,
Welcome to Naked from the
waist
Waist
down.
Down.
That's WAIST, not WASTE. However, we are going to talk about waist
Waist
today.
today. Yes, today's topic. My name is Martha Clay. I'm a urological nurse practitioner with over 40 years of clinical experience.
I'm Melissa Blackburn, nurse practitioner, and let's see, I have a lot of years too, but not 40, but I'm getting close. So,
But today's topic, moving right over that, today's topic is fecal incontinence. Fecal incontinence is defined by the loss of stool, solid or liquid, or mucus. The incidence of this is for non-institutionalized people in the United States, at least 8%. It increases with age. The estimate is that by the age of 70, 15% of Americans, both male and female, are fecally incontinent.
I think that's a lot. Do you think that's a lot?
It's a lot.
15%, so that's like 15 out of 100
Hmm.
people. I don't know,
Well,
poop in their pants. It-
it's a big
It's
quality of life
right,
issue. That's
exactly.
what we're here to talk about
And again,
today.
and that's non-institutionalized people. So non-nursing home, um, people,
Community, people in the
right, out in the
community,
community,
people
otherwise
that you're
healthy.
swimming
Yeah,
with, the
yeah.
people that you're taking hot tubs with. Just saying, you know. Hey, well, why is that? Why does that crack you up?
I don't know, because poop just does. It just never gets old.
There's a reason why I don't swim in a pool.
Pool. You
I
never know
understand,
who's been there.
there's toddlers and then there's
Yeah.
people my age, and it just
Yeah.
is what it is.
Yeah. So main causes are, well, could be congenital, but either digestive or some type of trauma, trauma being childbirth, which actually is the number
Number
one
one.
cause.
Mhm.
So you would think it would be a higher incidence than in women, but it's actually not. It's still equal across the board, but or spinal cord, people with spinal cord injuries have issues with bowel incontinence, other things like any sort of trauma to the rectal anus.
For example, horseback riding,
Yep.
bicycle riding,
Yeah.
you know,
You have those little micro traumas if it's something that,
truck
you're
drivers who are sitting all day
bouncing.
long for, 8 to 10 hours a day.
Mhm.
Anyone like I think about the UPS truck drivers, they're all in a truck,
Mhm.
our mail carriers,
Yeah.
you know.
And then digestive things. So it would be foods that, I mean, if you don't have an underlying digestive issue, like if you're lactose intolerant, obviously, you probably want to stay away from dairy, or you know that it's gonna go right through you, or IBS type of problem. But certain foods, alcohol,
Alcohol, caffeine,
yep,
chocolate,
yep.
all the good stuff.
Are you quitting happy hour?
I am not quitting happy. I am not.
We'll poop our pants so we can
We
have
all make
wine.
choices. We all make choices.
Poop or wine.
I'm going with wine. Anyway,
Making me pee my pants.
I'm moving on. I am moving on.
All
Okay.
right, good.
Now I want to talk about how you practically manage fecal incontinence. Um, Not surgically, just how you as an individual day to day. And number one is get enough fiber in your
Mhm.
diet. And you can do this through food. Probably one of the highest
Mm.
fiber foods I can think of are legumes and beans.
Yep.
Make yourself have a half a cup of minestrone soup every day, of lentil soup, of split pea soup. A half a cup is not much, but that's a good way of getting fiber into your diet.
Peanut butter.
Peanuts, nuts are
Mhm.
very high in fiber.
Mhm.
You should get a list of which foods are really high in fiber content and try to put that into your day to day in a way that works for you, that's palatable, but increase the fiber content. I will tell you what I personally do. Most of the professionals tell you to use Miralax. I personally find that very irritating. It
Mhm.
produces so much gas, it's not worth it. But my nutrition neighbor said, go and get psyllium. and titrate it. Start out with 1 teaspoon a day into a glass of water. If that's not working for you, increase it to 2 teaspoons, up to 3 teaspoons a day. And you can get psyllium in a lot of places. I go to Trader Joe's, not that I'm backing Trader Joe's, but I do love Trader Joe's. But that's where I get it. Um, so just
Bananas.
bananas, very high in fiber.
Apples have good fiber and
If you're eating the skin is the where all the fiber is in any vegetable or
yep,
produce.
vegetables.
Uh,
Yeah.
high fiber cereals. I personally eat kashi go lean. I have a bowl of that every day that has about almost 20 grams of fiber in it. So, get that into your diet however you can to stabilize
Yeah,
yourself.
that's one way. The
Yeah.
other another way is medications, whether they're over the counter or prescription.
What would
So
what would be the
like
over the counter?
Imodium, or prescription be Lomotil, depending on the severity.
Yeah.
But of course, you're always going to consult your provider,
Yep.
you know, on a plan of how to approach it. Diet's a given, but as far as medications,
But the thing that I want to talk about, which is money well spent, is a bidet. A bidet can be installed by anybody. It doesn't have to be a plumber. And there's a huge range of them out there. About $300 is what a really good bidet
yeah,
costs.
because you like just connect it like
That's all
to
you're
the
doing.
water source.
Hmm.
So, but how'd you come up with that idea?
Because I went skiing in Japan, which has the best snow in the world, for 15 days. Every public toilet in Japan has a bidet.
So it's not just Italians.
Every public toilet. I was on the backside of ski mountains, went in to use the bathroom, and they all had bidets. And I thought, this is brilliant. The number one cause of urinary tract
Mhm.
infections is an organism called E. coli, which is in your digestive tract and comes out through your stool. So it's called auto inoculating. You are yourself creating the infection.
Yeah, contaminating.
You're contaminating yourself by wiping yourself from your rectum towards the front of your body, which is where the urine comes out, the urethra. And if you're fecally incontinent, you're sitting in it for some percentage of the time, moving around, and you're dragging that stool up towards your urethra. And as you get older, your urethra gets thinner, drier, shorter. It's very, very easy.
That's specific for to women because men it's a little
Well, I'm
different,
just
but
talking about
yeah.
girls here, that it's very easy to contaminate yourself and thereby causing a urinary tract infection. So, for those of you who are not fecally incontinent but get lots of urinary tract infections, get a bidet. And it's like a little computer. You can uh, um, create it so that it works for your anatomy, whether it's coming to the front of your body, to the back of your body, the temperature, the velocity of how fast or soft the water comes out. You can,
It's a little shower for your
yes,
private
and
area.
without dragging with a piece of toilet paper. It's
Yeah.
just water. It's the most hygienic thing that you can do. Also, if you're fecally incontinent, what do? You have to go into the shower and rinse yourself
Clean up.
off. And
Yeah.
that's a drag to have to take your clothes off. It's disruptive to your day. But if you have a bidet, you just have to sit, push the button, it rinses you off. Really highly recommend that you consider this. It's not a lot of money, and it really will decrease your chance of getting infection, and it'll just make you feel cleaner and be able to move through your day a little bit more dignified.
However, though, plan B could be, and it's less expensive, and that we use for the patients in the nursing homes are the Perry bottles. So women know because they're the little squirt bottles that they give you after childbirth to kind of rinse the area.
And the cheapest way to do this is to go to your local convenience store,
Yep.
get a bottle of water that has a spout on it,
Mm,
and use that. Keep it next to the sink where
mhm.
you go to the bathroom, fill it with tap
Yep,
water.
warm water.
And
Yep.
after you've either urinated and or defecated or been incontinent of either urine or feces, take that bottle, sit on the toilet, and just
Just
squeeze
rinse.
it. And you'll create a little stream of water to rinse yourself. Remember, from front to back.
Hmm.
So make sure you're sitting in such a way that the water will go towards the rear of your body, towards your rectum, and that's the simplest, cheapest way to deal with.
And you could take that like on the go. Like
Yes,
you
right,
could
of
put
course.
us up, yeah, 'cause it looks like a water bottle.
Yeah.
So,
So we just want to make sure that you have a better quality of life that's simple, effective.
right, so you're not like in the bathroom using wads of toilet paper, which we know don't work, trying to wipe, and
And
it's just,
you're just dragging all that stool. It's
yeah,
inevitable. You're going to contaminate your little urethra that's all tiny and thin and dry, and you're just going to create a urinary tract infection, a bladder
right.
infection. So these are just very simple, practical ways to try to manage this for yourself.
Yep. And then, I mean, if it's really bad, I mean, of course, there's varying severities, but if it's super bad, there's, I mean, surgical options and,
Right.
so definitely you want to talk to your doctor. But I mean, the simple things that you can do are diet, spray bottles, or bidet, incontinence type of pad to help.
Yeah, you have
I
to.
mean, if you're in the car
You
or
have
if
to.
you're in the store and you
You're in
want to
a
be able to
meeting
make
for an
it to the,
hour.
right, you
Yeah,
want to be
right.
able to make it to the bathroom. So
Uh-huh.
at least you can change out a pad where you don't want to be changing out your underwear.
Mhm.
Mm.
Always carry an extra pair of underwear in a little zippy bag.
So
Work.
you can put the dirty ones in the zippy bag.
Yeah. Is that good?
Yeah,
All
that's
right.
good.
We hope
So,
this was helpful,
yeah,
and we hope that this helps improve the quality of your life. Thank you for
that's our
listening.
main goal.
Yeah.
Yeah.
Thanks
All
for
right.
listening.
See you again.
Bye.